Hi, I'm Michaela. I'm a GP. I see kids and their families to help them with their physical and mental health.
What is a general practitioner, GP?
As a GP, I'm often the first port of call for people to come and get help with a great list of reasons. People come and see me for physical things like aches and pains, coughs and colds. They might also be worried about other things like tummy aches, headaches, waking up in the night, particularly kids. They might not want to go to school, they might be having nightmares, or there might be another reason where the mum and dad are thinking, something's not going well for my child here.
What can I expect if I see a GP?
When you come and see a GP, our first step is to find out what's going on for you. You're the expert in you and your child's wellbeing. My job's then to help explore and do a bit of detective work on what might be new that's going on. Once we have those ideas, we then can sit down together and decide what can we do next. There's lots of options. One of the really helpful ones is to get a referral to someone who's an expert in the area where you need help. A lot of people don't understand there are other things a GP can do as well as the referral for a particular problem. For example, if I've referred a family to see a psychologist because their child's having anxiety going to school, there might be a long wait for that. Coming to see me with the child, we can start some help for that child and also support the family. One of the things a GP has is that they know the family. A good example is when a child's refusing to go to school. That can be a really stressful time. We've got an upset child, but you've also got parents who are having difficulties with getting to work or being called away from work to pick up their upset child. This is where your GP is a really helpful person to talk through these things, troubleshoot, and even get some support with talking to the school.
How do I access a GP?
Any GP practice, you can ring up, get an appointment. The receptionist will be able to help you on finding a GP that might suit best. It's really common for families to ring and say, I'd like to see a GP about my child. And if you feel safe enough, it's really okay to say, look, they're struggling at school, which GP would be great for them to see? When you're looking for a GP, it's also important to remember that you want someone that you gel with, and everyone's different. And it's okay if you've tried GP and think, I'm not really gelling with them the way I'd like. It's okay to try another one. So when you see your GP, there will be some support from Medicare. Medicare will contribute to your visit to your GP. Some GPs will accept this as full payment for the consult, but not all of them. When you ring the practice, it's really helpful to ask, does this GP charge an out-of-pocket expense? Then you'll find out what the total amount expected will be on the day, and also find out how much of that you will get back from Medicare.
How can I get the most out of my visit to a GP?
Before seeing your GP, have a good think about how much time you'd like. If there's something that's bothering you that you want to explore, particularly if you're feeling your child might have a psychological or mental health concern, it's really helpful to book a long appointment. And you can do that through the receptionist. When you come and see your GP, do come in with all your worries. Be aware you won't be able to deal with them necessarily always in that first appointment, but it's really helpful to the doctor to know exactly what you are worrying about. So for example, if your child's having tummy aches but also waking up in the night with nightmares, let the doctor know about both those things. We can then explore what might be causing the issues for the child, and if they need further tests or physical examination that can't be fit in that appointment that day, then the doctor can book you another appointment to make sure everything's done properly.
A final word.
As a GP, I'm here to support you and your family. It's really important to know that I'm here like your cheer squad. You're the team on the field playing the match. I can see you know what you're doing, but I'm here to back you up when things get tough.